in hospital for injuries but was later discharged.
Next tonight, a Derbyshire company says it could save the struggling NHS at least £30 million a year. Not by cutting staff either, but simply by recycling old hospital equipment.
It's begun a trial with Nottingham's two main hospitals, who say the idea could transform the way the health service operates. Carolyn Moses reports.
It's known as the Trolley Hospital, a place where hospital equipment's brought back to life. This is Reviva, based at Tibshelf, and it's hoping to help revive the finances of the NHS.
We want to reject throwaway society. We want to try and reuse equipment. So we bring it back, strip it all back to its bare steel, repair anything that's damaged, and then repowder coat the equipment and put it back into service as new.
And here are some they made earlier. Service trolleys, bins and metal holders recycled and handed back to Nottingham's hospitals. It's a trial which has run for several months, and managers say they've already seen equipment costs plummet.
Historically, traditionally, what would happen with those is they'd be scrapped. So then you've got the cost of the scrapping, you've got the cost of replacing, you've got the time it's got to come back. The solution we've got is, you've got a piece of equipment now that's going to last you 10 years, and it will save you about a third of the price of the other. So it's not buy one, get one free, it's buy one, get two or three free. So it's got a major impact on the finances of the NHS.
Hospitals estimate that if they recycle simple things like this oxygen trolley or rubbish bins, it could save the NHS more than £30 million a year. And if the NHS recycled more complex items, wheelchairs, it could save billions.
It is very simple, but I think very, very effective. If we can make this more national, we could bring much bigger savings to the community. It's a feel-good factor, isn't it?
The Department of Health says it welcomes innovative ideas and will study the results of this trial. If it proves successful, pieces of equipment on many more wards could make their own recovery too. Carolyn Moses, BBC Midlands Today, Nottingham.
Wow.
Excellent idea.
The engineers building Nottingham's tram extension are facing one of their biggest challenges yet.
Yes, next month a huge bridge built on site at the Queen's Medical Centre will be moved into position over a dual carriageway.
Meanwhile, the head of the extension project claims that attitudes towards the tram are